question is, can I get an STI despite using protection?
Yeah, that's a great question, and it was a relatively common one that came through to Dolly Doctor for those young people who were already engaging in sexual activity, which wasn't actually the majority of readers, but it's certainly a common question and something that I do talk to clients that I see in my clinical practice. The short answer is yes, you can, but the longer answer is it does depend. And it depends really on the characteristics of the actual microorganism that are causing a particular STI. I like to think that with all the sort of difficulties we've experienced in the last 14, 15 months with the COVID pandemic, one thing that I've noticed has happened is I see around me, amongst young people, amongst colleagues who are not health professionals necessarily, a real increase in what I call health literacy around transmission of infectious diseases. And I think we now have, as a population and around the world really, a better understanding of, something like COVID, how it's transmitted through respiratory droplets and why we wear masks and why we wash our hands and all that kind of thing. So if we think about STIs, it's straightforward in the sense that these are microorganisms that are transmitted through sexual contact and different types of sexual contact. The microorganisms that make up a whole lot of different sexually transmissible infections or infectious agents are bacteria, viruses, and parasites mainly. They're the big groups, but within those groups, there's lots of different ones. So the reason it depends as to whether you can catch an STI or whether it can be transmitted without protection. And by that, I'm referring to barrier protection. So things like latex condoms and dental dams. It depends on the particular infectious agent, which part of the genital tract, or even so that the mouth and tongue and back of the throat, which part of those anatomical locations they actually are able to invade and multiply and thrive in order to cause infection. We have microorganisms living all over our bodies and inside our bodies all the time, and a lot of them are really healthy and we need them. But the ones that can cause an infection are what we call pathogens, and they can destroy tissue, damage tissue, and cause symptoms or be transmitted without our knowing. And STIs really are often asymptomatic. So if we take a really common one like chlamydia, which I know you've all heard of, that's a bacteria. It's quite fastidious in that it kind of only really can survive in certain parts of the genital tract and the back of the throat. So the cervix in women, the urethra in men and women, and it can only really be successfully transmitted from one person to another through physical contact with the secretions, genital secretions, so semen, cervical mucus, vaginal secretions. There has to be that actual physical touching. Something like herpes, genital herpes, which is caused by a virus, it creates little ulcers, micro ulcers. Sometimes you can't even see them on the skin surface or the surface of the lining of the mouth and tongue and the genital tract. So in that situation, if you do have the virus living in that part of your body, then it can be transmitted through skin-to-skin contact. It can also live in some of the secretions. But of course, things like the male condom, female condom, and dental dams don't necessarily cover all those parts of the skin and lining of the mouth and genital tract that, where the virus could be living. So that's why there are some STIs where you aren't going to get necessarily full protection, whereas something like chlamydia, you've got a really good chance of it not being able to be transmitted, provided the barrier stays intact throughout all of the sexual contact, is much more likely to protect you from catching something like chlamydia. So that's a very long answer to that question, but I hope I've kind of explained the thinking behind it.
Yeah, absolutely. And I think it is really important that when we're having conversations with young people, we are reminding them of those skin-to-skin infections that we can pick up. And I think because something like genital warts, for example, has really dropped off the radar for young people, given the human papilloma virus vaccine that they were offered, we do need to be mindful, particularly of herpes and those skin-to-skin contacts, which can still pass on those viruses. So really good points. Thanks so much for that one.